Let's begin the lecture, and in the first section of our lecture now we will discuss some congenital lesions of the larynx, and the congenital lesions which we will discuss in this section will be the laryngomalacia and vocal cord paralysis, congenital subglottic stenosis and laryngeal web, and also laryngoesophageal cleft and laryngocele. So all that we will discuss in this first section. So congenital lesions of the larynx, we have laryngomalacia, which is congenital laryngeal stridor. Malacia is the softening, this term is known, malacia, whenever it is used, it means the softening of the, so in this the larynx is softened, the tissue is loose, so it can cause the stridor due to swelling, or we can talk about this later on. So laryngomalacia. Then the congenital paralysis of the vocal cords, congenital subglottic stenosis. Stenosis is the narrowing. We have glottic region, then we have supraglottic above the glottis and subglottic below the glottis. So these are the three regions. So in this we will talk about the congenital subglottic stenosis. Laryngeal web, subglottic haemangioma, laryngoesophageal cleft, laryngocele, and then we will talk about laryngeal cyst. So all these are different congenital lesions of the larynx that can lead to the complications associated with larynx, and it's mainly associated with the sound production, so it can affect the sound directly or indirectly. So first is the laryngomalacia. It is characterized by excessive flaccidity of supraglottic larynx, which is sucked in during inspiration, producing stridor and sometimes cyanosis. So again, as I mentioned, is the softening. So it's excessive flaccidity. The tissue becomes flaccid, smooth, soft of supraglottic larynx, which is sucked in during inspiration, producing stridor and cyanosis, which is bluish discoloration of the skin due to breathing obstruction or difficulty in breathing. So it can cause stridor and cyanosis. Most common congenital abnormality of the larynx, laryngomalacia. Increased on crying, manifest at birth or soon after birth. So it's present at birth or soon after the birth. Disappears by 2 years. The diagnosis of laryngomalacia is by flexible laryngoscope. So examination of the larynx by laryngoscope. Direct laryngoscopy shows elongated epiglottis curled upon itself. So in this case, the epiglottis is elongated, become enlarged, and because of that increase in the length, it curled on its own. So epiglottis is elongated. Floppy aryepiglottic folds and prominent arytenoids. So these are some findings on direct laryngoscopy. The conservative treatment is tracheostomy. Tracheostomy, especially when the breathing is obstructed, then the tracheostomy is performed, in which the hole is made in the trachea and tracheostomy tube is inserted for breathing. And supraglottoplasty. So this is the supraglottoplasty or repair of the supraglottis. These are the conservative treatment to improve the condition of the patient and conservative managements. Then the other condition is the congenital vocal cord paralysis, result usually from the trauma at the time of birth. The paralysis is due to the recurrent laryngeal nerve stretching that occurs as a result of the trauma, and the stretch of the recurrent laryngeal nerve cause the paralysis of vocal cords. During breech delivery, forceps delivery, and any anomalies of the central nervous system can lead to paralysis of the vocal cord. Congenital subglottic stenosis below the glottis, congenital subglottic stenosis or narrowing. You can see the narrowing. Here then we have, it is an abnormality due to thickening of cricoid cartilage or fibrous tissue seen below the vocal cords. Child may remain asymptomatic till upper respiratory infection cause dyspnea and stridor. So as the name shows, the stenosis or narrowing, that stenosis now is because of the thickening of the cricoid cartilage or fibrous tissue. As a result of the thickening of cricoid cartilage or fibrous tissue, there is stenosis, and usually unless the respiratory tract superimpose infection occurs, the symptoms become more prominent, and this infection can cause dyspnea and stridor. Cry is normal. Diagnosis is made when the subglottic diameter of the subglottic area is less than 4 millimeter in full-term neonates and 3 millimeter in premature neonates. Then the symptoms of the stenosis appear. So if the size is less than 4 millimeter in full-term and less than 3 millimeter in the newborn neonates, premature neonates, then the symptoms of stenosis develop. Improve as larynx grow, some require surgery. So as the larynx grow, this condition improves, this stenosis is overcome, but in the beginning the dyspnea and stridor is present. But if it's not get better, then the surgery is required. Laryngeal web, it is due to incomplete webbing is due to incomplete recanalization of larynx. So opening of the larynx is incomplete recanalization of larynx. Mostly the web is seen between the vocal cords and has concave posterior margin. So web is present as a result of incomplete recanalization. The opening is not complete, recanalization is not complete. That leave a web, and that web is seen between the vocal cords and has a concave posterior margin. Presenting features are airway obstruction, weak cry, aphonia dating from birth. So airway obstruction can occur, there is a weak cry, and the aphonia or lack of production of sound is present. The treatment is usually depend on the thickness of the web, how thick is the web. In thin webs, cut with knife, and carbon dioxide laser is used. If the webs are thick, then excision via laryngo fissure is done and placement of silicone keel is performed. So that's the two treatment options depending on the thickness of the laryngeal web. If it's thin, then we cut it with the knife and use carbon dioxide laser. If it's thick, we do the excision via laryngo fissure and placement of silicone keel. Subsequent dilatations are also performed, so it should not be stenos back or come back. Subglottic haemangioma. It's congenital. Patient is asymptomatic, 3 to 6 months of age, stridor, but no normal cry is present. Agitation is airway obstruction, can cause agitation, or agitation can lead to airway obstruction. Direct laryngoscopy shows reddish blue mass below vocal cord. It's reddish blue. Hemangiomas are reddish bluish in color, and that's because it's congenital and it leads to stridor, but normal cry is present. Airway obstruction can occur. Usually patient is asymptomatic until 3 to 6 months. Biopsy not always associated with hemangioma. Treatment of hemangiomas depend on individual case, tracheostomy and observation, steroid therapy, dexamethasone, and carbon dioxide laser excision if lesion is small. So these are the treatments for the laryngeal web. If the tracheostomy is performed, in case if the obstruction is severe, then we can use the steroid therapy and carbon dioxide laser excision if the lesions are small. Next congenital condition is laryngoesophageal cleft and laryngocele. Laryngoesophageal cleft is failure of fusion of cricoid lamina. When it's not fused properly, it leaves a cleft. Repeated aspiration occur as a result and pneumonitis. Coughing, choking, cyanosis, laryngocele, dilation of laryngeal saccule, internal, external, or combined type of laryngocele, and endoscopic or external excision is the treatment. So again, two conditions. Cleft is treated by it's because of failure of fusion of cricoid lamina. Repeated aspiration and pneumonitis occur. There is coughing, choking, cyanosis, and then we have dilatation of laryngeal saccule, internal, external, or combined, and then we have it can be treated by endoscopic or external excision. Laryngeal cyst. Cysts are fluid-filled sacs. You can see the cyst present. So laryngeal cyst, it arises in the aryepiglottic fold and appears as bluish, fluid-filled, smooth swelling in the supraglottic larynx. Then we have respiratory obstruction, which necessitate tracheostomy. So if we have respiratory obstruction occurs, then we need the tracheostomy. Needle aspiration or incision of the cyst, drainage of the cyst. Treatment is de-roofing of the cyst or carbon dioxide laser. So that was all about the different congenital abnormalities of the larynx. Thank you for watching sqadia.com.